Hi there, it's Ed Thompson here, and today we're going to talk about pain. Now, I know it's not the most uplifting of topics, but by the end of this video, I think you should have a better understanding of why it's quite a good thing most of the time, and also understand a bit more about how it works as well. So, like I said, my name's Ed Thompson. I run Instant Physio, which is a physio practice based in South London, and we specialize in helping people get back to being active and overcome the frustration of being in injury, being in pain. Um, so let's get started. So we're going to go through 5 things I bet you didn't know about pain. And the first one is that pain is made in the brain. Now, it's something you may have heard before, but the reason why it's important to know is because your brain is the thing that decides whether you're whether you're going to experience pain or not. And pain is there to protect us and to highlight some sort of threat that your brain has picked up on. Um, and it's up to your brain to decide if it's a threat for now and if it's putting you in danger now or if it's something that can wait, basically. And we'll go on to what I mean by that in a second. So the way I would explain it is if you've ever seen Catch Me If You Can, and they bring the check to those guys that are in the kind of print shop, and then these old guys kind of look through it and they're like, oh, whereabouts do they make these checks with this ink? Oh, in Europe, in Germany, in France. And that's what your brain does. It deciphers information and uses past experiences and the skill and the maybe not the skill, but the yeah, past experiences to decide what the best outcome is. And the second thing that I don't think you'll know about pain is that pain is largely based in on context. So what does that mean? So someone's pain experience might be totally different based on what situation they're in. So an example I might give is me playing rugby in the park with my friends, and I fall over and smash into my shoulder, and um, there's a good chance that I'm going to be in a lot of pain. I'll probably stop the game. I'll probably be complaining to my friends about it for the rest of the day, and um, that would be different to if I'm the fly half for England in the World Cup final in the last 3 minutes, and it's me to take the kick that's going to decide if we're going to win the World Cup or not. Um, and the pain experience that I would experience there would likely be a lot less because there's something far more important that's at stake than my shoulder at that moment. And there's plenty of examples of that. Another example would be where um, someone is, in a situation where they're saving others. So there's situations where people have been attacked and they may have taken a really bad injury to their leg, but until they've helped their friends, it's not until afterwards that they've got their friend out of danger that they've realized that they've been attacked and had a huge injury to their leg, and then started to feel pain. So um, your brain decides what the context is and whether you're in danger now. So therefore, the brain, you need to get yourself out of that danger, or if there's no danger at all, and it's important to look after the injury that you've just sustained. So there's lots and lots of other examples. I could do a whole video on that. I mean, there's examples where people have done studies and subjects, when they've been given a painful stimuli like a little electric shock or something and been shown a red light, the pain experience is higher compared to if blue light is shone at them at the same time. Or um, similarly, the same painful stimuli, which might be like an electric shock or something, um, done at the same time after someone said that it's going to be hot, is normally more painful than if they've said that the stimuli that's going to be painful is cold. So there's lots of tricks and things that can happen which really dictate how much pain you experience, basically. A personal story for me, it would be when I was at university, and I think I looked in my yeah, I looked at my teeth for some reason. I was supposed to be doing some um, my dissertation, I think, and I was like, wow, what are those things in my teeth? Um, and basically started to freak myself out. And I basically started to experience toothache for the next few days. I was like, what is going on? Um, I think I've got these like things in my teeth. I think there's like something seriously wrong. And then I went into my friend's, my housemate's bedroom and just said, you seen these? And he wasn't a dentist. And just, oh yeah, I had those. Did you have braces? Yeah. He was like, yeah, that's just from braces. I think it was just like a bit of glue or something. And the pain stopped immediately. Um, and nothing had changed. I decided that there was no longer a threat, and therefore the pain stopped. So it either shows how I'm very trusting, or that yeah, your brain decides where the threat level is. Okay, so number 3, your brain has the ability to turn pain up and down, turn pain down. So I've already kind of talked about that, which I think is kind of crazy. The brain has the ability to take away pain completely and increase pain. So sometimes we call it the brain pharmacy, and that's where patients have surgery with hypnosis. That would be a good example, um, or someone can get their leg chopped off in a war situation and not really feel any pain. And there's plenty of stories of that, from various different soldier stories and things like that. Number 4 is the syndrome known as Couvade syndrome. That's where someone's husband or the partner or the father of the baby that's about to be born starts to feel the pain of childbirth in them. And it's a strange phenomenon where um, the husband or the father feels such empathy for the situation that they start to feel pain themselves. And there's some situations where the father can be the one that needs the medication and needs to be looked after by the mother. So it's a strange phenomenon where, again, your brain is deciphering the threat level and effectively making a mistake. And it's sort of just a really good example of how complex pain is effectively. And the last point I'll finish on is number 5, which is pain is entirely unique. So there's never going to be a time when we could say what you're feeling is what I'm feeling, because there's words in the English language that don't tell the full story. In fact, there's plenty, and pain is one of them, really, because as physios, we do our best to interview and get an understanding of how things feel. But there's never going to be a way in which we can do that entirely. And that's where things like what's called the visual analog scale, which is where you score your pain out of from 0 to 10. There are huge limitations there because a lot of the time there's no context. Again, where we're saying, oh, what's your pain out of 10 at its worst, but there's no context. So the word pain itself is really the tip of the iceberg, because for example, pain is normally associated with something unpleasant, but there are times when pain is not unpleasant and it's pleasurable, and there's such thing as emotional pain as well. So is that physical, or is that where is that pain? And there's lots of dead ends, and we're really not telling the full story when we're using that word. Really, it makes the job as a physiotherapist quite difficult, and that's the last fact about pain. So I hope you found today useful. The reason why we're going into this is because before this is the start of my YouTube channel. I don't want to start giving out loads of advice and things on exercises and things like that. until people understand the science of pain, because a lot of the time patients can walk out of a session feeling better without us even touching them or doing any treatment or doing any taping or anything, just because they've understood what's going on better and understand why they're in pain, because the threat level is reduced. So I want to start where we can make the biggest difference without really needing any rehab or any exercise or any rest, just from changing how you view pain. So stick around for the next video, where we might be going into a bit more depth about how pain is created and how it's important for runners and people who want to be active. So hit subscribe and we'll see you on the next video.